All right, guys, so this is Anatomy and Physiology, Fall 2017. I always start my videos by saying congratulations to all the seniors. So congratulations for getting this far in your high school careers. And yep, kudos to you all. So I'm excited for you all graduating. For the juniors, I also say congratulations to my juniors because you all will graduate quickly. This happens fast. So please stay on track and stay with your classes because you guys will be graduating in no time as well. Okay? All right. Again, this is Anatomy and Physiology, Fall 2017, and this will be a presentation on medical terminology, specifically as it relates to body structure and human structures in the body. Okay? All right. So I'd like to begin with our model here. Our model here is facing frontal view, or this is called frontal or ventral view. We can also say if this body was laying down, face up, we would call that supine position. And if the body was turned around, we would call this the dorsal or posterior view. If this person was laying down on their face, that would be called pronation or pronated. Okay? I'll turn the body back around, and I will begin superiorly and work my way inferiorly. I will begin first by acknowledging these salivary glands. We have 3 salivary glands in the body. One of them is called the parotid gland, which is located laterally on the chin area. We also have the submaxillary gland, which is located directly under the chin, or I should say partially a little lateral and under the chin. We also have a salivary gland called the sublingual gland. The sublingual gland sits under the tongue. Okay? 3 salivary glands found in the mouth. Salivary glands function in releasing saliva. Okay. Moving forward, working my way inferiorly, you'll see there are 2 major structures here in the neck. They are called I will call them just generally blood vessels for now, but can break them down even further into the blue, which we represent in models as a vein, and red, which we represent in models as an artery. Okay? Getting more specific, the blue vein is called the jugular vein, and the red artery is called the carotid artery. If you note, these 2 structures or blood vessels sit next to each other, so we refer to that as lateral. If I were to use it in a sentence, I would say the jugular vein is lateral to the carotid artery. Moving medially, I have this structure here, which is blue in this model, called the larynx, commonly called to or referred to as the Adam's apple in men. The larynx is located on the white structure. The white structure is the trachea. The trachea moves down into the thoracic cavity, and it moves into the thoracic cavity and moves into the lungs. Moving inferiorly from our larynx, the blue structure in your model, we have this butterfly-shaped structure called the thyroid gland, and that is inferior to the larynx. Moving inferiorly, my hand is on the thoracic cavity. Medially speaking, we have this structure here called the sternum. That's the sternum or breastbone. Moving laterally, forms our rib cage, and so I would say the sternum sits medially to the rib cage, which sits laterally. Located in the thoracic cavity, we can have lungs, and I can pull back the thoracic cavity, and you will see a lung located posterior to your thoracic cavity. However, I will qualify this and say that our lungs will sit specifically in their own cavity within the thoracic cavity called the pleural cavity. Removing the thoracic cavity, you get better exposure, and you can take a look and see. You'll start to see some of your pleural cavity with a sagittal or vertical view of the lung. So you can still see posteriorly some lungs still present. However, anteriorly, we also have it again positioned behind the thoracic cavity in the body. Moving inferiorly, again, I'd just like to point out that the trachea is in white. I mentioned earlier it moves down inferiorly into the thoracic cavity, and it does what I call bifurcate, split into two, and moves into each lung. You'll get a better view of it here as I remove the thoracic cavity in this section. If I move down inferiorly, you will see there are two structures. This structure here is called the mediastinum, where the heart is located generally. Heart is removed in this case, and I will use my fist as the heart. Connect my finger to this vessel, which is the aorta. The aorta, spelled A-O-R-T-A, is the largest blood vessel in the body. It runs the length of the body, and it will continue down into the abdominal pelvic region inferiorly and become part of what we call the abdominal aorta. Moving here posterior to the heart, however, you still see a couple of sections here. One structure you'll see here in beige, this is the esophagus. The esophagus runs specifically from the mouth and runs posterior to the trachea, moving down into the mediastinum, posterior to the heart. Next to it, you see this red structure. This is called the aorta, largest blood vessel in the body. And splitting the thoracic cavity superiorly and the abdominal pelvic cavity inferiorly will be this white structure called the diaphragm. As I move into my abdominal pelvic cavity, I have my liver. If I remove my liver posteriorly, I will get the gallbladder. I move from the gallbladder to the stomach. Located behind the stomach is the spleen. Moving from the spleen, you'll see continue down through our diaphragm, we have this red structure coming from posterior to the heart. That is the abdominal aorta. Moving into the peach area, this is called the pancreas. Posterior to the pancreas, we see these brown structures. They're both bilateral. They are called the kidneys. And moving from the kidneys, you will see that they have ureters, which are bilateral, and extend down into the bladder. Going back to your intestinal area, you have the peachy structure in the front, anteriorly called the small intestine. And the large intestine is called, it also looks gray in this model, called the large intestine. The small and large intestine both have 3 sections. I'd like you all to look up each section. 3 sections of the small intestine and 3 sections of the large intestine for your exam. Last piece, if I move down inferiorly again, going through, I'll follow my abdominal aorta right down into the abdomen or abdominal pelvic cavity. Moving inferiorly, this structure or these vessels will split, again bifurcate, and become the iliac arteries in the pelvic cavity. These arteries will continue down into the legs, become the femoral arteries, continue down into the knee, called the popliteal arteries, and move further into the leg, called the tibial and fibular arteries. Okay? And there is where I will leave it. Thank you, class.